All right, so we're diving into some pretty interesting news about H5N1 bird flu in the U.S. today. We're looking at a brand new press release straight from the CDC. That's the Centers for Disease Control and Prevention. For anyone who doesn't live and breathe acronyms, you might be thinking, bird flu, isn't that like a problem for farmers and stuff?
Yeah, it's easy to think that, right?
But this newest announcement from the CDC really, it kind of changes things up a little bit. And we're going to break it all down for you in this deep dive.
It really does change things. It's definitely worth paying attention to, I think, because it could actually end up impacting all of us.
Okay, so the CDC report, it really highlights this first severe case of H5N1 in the U.S. They say there have been 61 total cases reported since April 2024. But this one's out of Louisiana, and this one is different. So why should this specific case make us kind of sit up and take notice?
Well, this case is, it's kind of a game changer because it's the first one that they've linked to backyard birds. All of the previous cases were connected to, like, commercial poultry farms or the dairy industry. So this means that the virus might actually be spreading in some new ways.
So it's not just a problem for, big poultry farms or whatever anymore. People with, like, backyard chickens or bird watchers, or even just people who live near places where lots of wild birds, hang out. They could be at risk now, too.
Yeah, exactly. It really expands the potential exposure points. If you think about it, like, it's like you're playing dodgeball and suddenly the other team gets like twice as many balls to throw at you.
Okay, now I'm really intrigued. So the report mentions something called genotypes. And it says that this Louisiana case involves a specific genotype called D1.1.
Yeah.
And wait a minute, didn't some recent cases in Canada and Washington State also involve a similar genotype?
Yes, there are definitely some connections there. You can think of genotypes kind of like different models of a car. They all kind of look similar, but they might have different engines and different capabilities. This D1.1 genotype, it seems to be a bit more powerful, we could say, meaning it's just spreading more easily among birds.
So this isn't just any bird flu. We might be dealing with a strain that's much better at spreading around. Does that mean it could jump to humans more easily, too?
Well, that's the million-dollar question, right? And it's definitely something that researchers are looking into very, very carefully. Now, the CDC clearly states that there is no evidence of human-to-human spread yet. But if we look back historically, some H5N1 strains have shown that potential.
Okay, so no need to panic just yet, but definitely something to keep an eye on. So if this D1.1 genotype is spreading more easily and it's now showing up in backyard flocks, shouldn't the overall risk level be higher? CDC still says the risk to the public is low. But is that really still accurate? I mean, with all of this new information?
That's a great question. The CDC is likely just being cautious, I would say. One isolated case doesn't necessarily mean that the risk has, skyrocketed for everyone overnight. However, we do need to be very vigilant because there are certain factors that could change that risk assessment very quickly.
Like what? What kind of things should we be watching out for?
Well, the biggest, I guess you could say, red flag would be any evidence of sustained human-to-human transmission. If that starts happening, then the game changes completely. Also, a sudden spike in the number of cases or mutations that make the virus even more transmissible, those would be causes for concern as well.
So we've got this potentially more contagious genotype, the backyard bird situation, and the first severe case in the U.S. This is all sounding a bit unsettling to me. What can we actually do to protect ourselves? Give us the practical tips.
Well, I think the most important thing, and it might seem really obvious, is to avoid any contact with birds that look sick or dead. This is especially important for people who hunt or who watch birds or have those backyard flocks that we talked about.
Right, so don't cuddle that sick-looking robin. But avoiding contact isn't always possible, especially if you have like chickens in your backyard or live in an area with a lot of wild birds. What else can people do to minimize their risk?
Well, good old-fashioned hygiene goes a long way. Washing your hands thoroughly with soap and water, especially after being outside or handling, anything that might have come into contact with birds, that can really reduce your risk.
Yeah. It's funny how we often just overlook the simplest things. We're all so used to hand sanitizer these days. But sometimes the classic methods, those are still the best.
Absolutely. Yeah. And let's not forget about disinfecting surfaces, too. If you've been around birds or in areas where they might be, a good wipe down with disinfectant, that can't hurt.
So avoiding contact, washing hands, disinfecting. Got it. What about staying informed? Any advice on how to keep up with all the latest developments on all this?
Yeah, absolutely. The CDC website, that's a goldmine of up-to-date information on H5N1 outbreaks. They have all sorts of recommendations for how to protect yourself, what to do if you think you've been exposed, details about any outbreaks happening in specific areas. You can also check with your local health department. They're usually a good resource for localized information.
So staying informed is crucial. They say knowledge is power. Right. Okay, we've covered a lot of ground here. I think it's time to maybe take a step back and think about the bigger picture for a sec. What are the potential long-term implications of this first severe case, you think? Could this end up changing how we approach public health policy or research priorities, or even just our relationship with backyard birds?
Those are all excellent questions. It's really hard to say for certain what the future holds, but, we can look at how we've responded to other infectious diseases for some clues, I think. I think it's safe to say that this case will probably lead to increased surveillance efforts. We need more data to understand just how widespread this particular genotype is and how it's moving through bird populations.
So more testing and tracking of both wild and domestic birds. That makes sense. What of the research side of things? Any implications there?
Oh, yeah, for sure. This situation really highlights how important ongoing research into effective vaccines and treatments for H5N1 is. Having those tools in our arsenal, that would really be a game changer, especially if the risk level were to increase.
It's like having a fire extinguisher handy, right?
Yeah.
You hope you never need it. But it's good to have it there just in case. Now, I'm curious about your thoughts on how this might affect, backyard birds. We've seen a real surge in backyard chicken keeping in recent years. Could this case lead to new regulations or recommendations for people with backyard flocks, especially in areas where this virus is circulating?
It's certainly possible. This case could easily prompt authorities to consider, stricter measures to prevent further spread. It's definitely something to watch closely. I think this whole situation raises some really important questions about how we balance, the enjoyment and the benefits of having backyard birds with the potential risks that they could pose to public health.
It's the delicate balance, for sure. All right, we're getting close to the end of our deep dive. Before we wrap up completely, is there anything else you think our listeners should know about this whole, evolving situation with H5N1 in the U.S.?
Well, I think the key takeaway here is that, it's a dynamic situation, right? It's really important to stay informed and follow those CDC recommendations that we talked about. Avoiding contact with, with any sick birds, practicing good hygiene, and just staying up to date on the latest developments. Those things can really make a difference in protecting yourself and your community.
Yeah, no, it makes sense. So it's not really about panicking or anything. It's about being aware, and taking some reasonable precautions. It's kind of like wearing a seatbelt in a car. You might not need it every single time you drive.
Yeah.
But it's there to protect you just in case. Okay.
That's a great analogy. And just like with driving, staying informed helps you make better decisions. The more you know about the situation, the better equipped you'll be to really assess the risks and take the right action.
Excellent advice. Well, that about wraps up our deep dive into the latest news on H5N1 bird flu in the U.S. It's definitely a complex and evolving situation, no doubt.
Yeah.
But hopefully we've given you a better understanding of what's going on and why it matters. Remember, stay informed, be cautious, and don't be afraid to ask questions. And if you actually encounter, a sick or dead bird, whatever, don't touch it. Report it to your local authorities or whatever. And let the experts handle it.
Yeah, absolutely. And remember, knowledge is our best defense. The more we understand about this virus and how it spreads, the better prepared we'll be to protect ourselves and our communities.
I couldn't agree more. Until next time, stay curious and stay safe.